Patients over the age of 65 are 16.6% more likely to visit an emergency room for an adverse drug event than 4.1% of younger patients. These visits are typically linked to poor transitions in care, and 88% of them can be preventable. Many of these elderly patients are on several different medications, which makes it very difficult for them to remember what each medication is for and to take them correctly. These elderly patients can get very confused about their medications. Because of all the different medications these elderly patients may be on, which may confuse them, it costs the U.S. healthcare system $3 billion per year. There are about 1.5 million adverse drug events that occur per year because of preventable medication errors. After these elderly patients are discharged from the hospital, 19.6% of them are still confused about their medication and are back to the hospital within the first 30 days of their being discharged. For Medicare patients, these second admissions cost almost $15 billion in Medicare spending. Once the elderly patient enters a skilled nursing facility, a pharmacist should ask the patient what medications they are on and then check the patient's chart. If the pharmacist recognizes that there is an issue with the medication prescribed or the medication that the patient is currently taking, he or she should contact the prescriber immediately to prevent any adverse drug event. Following the call, the pharmacist or nurse should speak to the patient about the updated medication list and the importance of adherence, as well as side effects to watch out for. A medication reconciliation is a very effective way for pharmacists to determine where a medication error occurred and how to fix it. A quick call to the hospital that the patient was discharged from can prevent multiple issues from arising in the future. There are 3 important things that can be done to reduce error during a transition in care. 1. A pharmacist can play a valuable role through medication reconciliation within the transition in care. They can prevent adverse drug events and improve patient safety, ensuring that all medications given are proven to be therapeutically beneficial. 2. By providing medication education to patients during a transition of care, pharmacists can reinforce adherence and compliance by teaching patients how to self-manage their own therapies appropriately and correctly when transitioning back out to the community. This can be achieved simply through counseling or other methods, such as providing patients with pill boxes and blister packs, and even supplying them with educational pamphlets. 3. Medicare data shows that between 41.9% and 70% of Medicare patients admitted to the hospital see an average of 10 or more physicians during their stay. When one patient sees an average of 10 or more physicians, it's important that all providers have the same medical information and properly communicate with each other in order to ensure the best possible care for the patient.